Namaskar, friends. We are looking at this three-step approach. First is check your health score on 11 parameters. Second, to know 11 mistakes what we are doing every day. Third is to follow this nine-step dinacharya. Friends, my name is Gangeshwara. I'm not a doctor. People with heart problem, kidney diabetes must consult their doctor. Now let's look at these 11 parameters. These are the 7 blood tests which are absolutely essential, friends. The ideal range is provided. Look at out of 11 parameters, this gentleman was okay only on 2 parameters. That means his health score is 18%. Now what are all the problems he had? 42 kg overweight, 15 inches oversize, waist size, blood pressure, pre-diabetes, dyslipidemia, D, B12 vitamin deficiency, and also is under medication. So what needs to be done? We all seen yesterday the lack of 7 hours sleep, chronic stress, sedentary lifestyle, lack of nutritious food, stimulants like coffee, tea, etc., intoxicants, and then processed food, sugar, refined oil, fast foods, dairy, bakery, cool drinks, ice creams, dehydration. People don't drink sufficient water, and that too they drink water wrongly. Poor gut health, constipation, gas, bloating. Some people are unable to pass stools even once, and somebody is going stools 2 times, once in 2 days, and some of them are going stools sometime in the afternoon or night. So very clear indication of poor gut health. Now, most important is multiple times eating in a day. Everybody is habituated to eat breakfast, lunch, and dinner in between coffee and snacks. So all this is causing overeating and it's causing you health problems. The most critical thing is happening is office culture. In most of the offices, shops, everywhere, people are habituated to coffee, tea, and snacks, and they don't consider it as food. So end of the day, most of the people are eating 5 to 6 times. See, other than water, everything is food, friends. Please remember, other than water, anything goes to the stomach, it gets digested, and there are sugars generated, and then to push the sugars into the cells, insulin has to work. The problem is if you are eating 6 to 7 times in a day, like that for years and years and years, so you will be having elevated insulin levels in the body, and for a long duration of high insulin levels in the body. So this is the reason for the insulin resistance. Insulin resistance can cause overweight, belly fat, blood pressure, PCOD problem, thyroid, and heart problems, pre-diabetes and diabetes. Overweight is a serious disorder, friend. A lot of people don't take it seriously. Not checking health parameters. I suggest anybody is about 20 years age, anybody is overweight, if they're even 15, 16 years also, we must get these 7 blood tests. That's how we'll be able to track our health score on 11 parameters. Friends, all these things will cause what? Toxins in the body, deficiency, sedentary lifestyle, poor mind management, lack of 7 hours sleep. They cause poor gut health and insulin resistance, and they all lead to chronic inflammation in the body, hormonal imbalance. That's how we get into lifestyle disorders. So let's see what needs to be done, friends. As we talked, this dinacharya, see, friends, there are 7 essentials for good health: chemical, air, water, food, excretion. Structure is exercise, emotional rest, and mind management. Say, for example, friend, your mom or spouse makes a very delicious sambar. So you want to make a delicious sambar. What you need to do? You need to check with her what are the ingredients and what are their quantities. Like a dal, maybe 1 glass, and salt, maybe 1 spoon. It's not the other way around. Having known the ingredients and their quantity, next step is the process. And the process you will learn with an experience, and then probably you'll be making sambar as good as your mom, or sometimes better if you have learned it properly. Similarly, for health also, these 7 essentials have to be part of your daily schedule. So this dinacharya, make sure that all these 7 are part of your daily schedule. So let's look at it, friend. Detox, chemicals and structural. What is this? Chemical means air, water, food. This is all happening. Exercise going to happen between 5 a.m. to 9 a.m. So these 4 hours are supposed to be fasting window. People who are habituated to have breakfast before 9 a.m. are having coffee, tea, or anything other than what is food. So stop that and practice this 4 hours window. Suppose somebody has to go to office at 7 o'clock. Yes, for them it may not be practical. So please speak to me. I will guide you differently. Each individual is different, friend. What suits one person may not suit the other person. So immediately after waking up, preferably before sunrise, drink 1 liter water. Focus your mind on your stomach with an object of going to the stools. You walk inside the house, you will be able to go. During that time, don't engage in any other activity, friend. Once you finish your toilet, go for a 1 hour brisk walk. exposed to sun and pranayama you can do. After returning 1 hour walk from the walk, rest for 5-10 minutes. Again, drink 1 liter water. Focus your mind on your stomach. You will be able to go to the second bowel movement. This is the time of detox, not eating period. So avoid if you're eating food, friend. Now, again, night 9 p.m. to 5 a.m. again is a fasting window. You should not be eating at that time. So automatically you are going to do 12 hours of fasting automatically if you follow this. Now, emotional management means stress management, friends, harmonious relationships, meditation, prayer, love for appreciation, gratitude, charity, let go attitude. Very, very important to not getting stressed. Positive thinking, non attachment, company of joyful people, satsangatvam, social integrations. All this would help you to manage your mind. Sleep, 7 hours night sleep is absolutely non-negotiable, friends. 9 p.m. to 5 a.m. People are working in night duty, people have other issues, they can discuss with me so that we can find a way. And also, friends, this is the time for rest to digestive system. How do you give rest to your digestive system? By simply fasting. You don't eat anything after 9 p.m. up to 5 a.m., friends. Anyway, again, 5 a.m. to 9 a.m. again, you are going to be fasting. So 9 p.m. to 9 a.m. is a fasting window. Now let's see what needs to be done. As we discussed, friends, chemicals. See, friends, if there is a fire, for whenever there is a fire, we put water in a big way so to quench the entire fire. But suppose there is a petrol pipe is leaking into the fire, first you must stop the petrol leakage into the fire. Similarly, you must stop all this inflammatory food. Avoid or restrict sugar, salt, sweets, dairy, processed foods, packaged foods, refined oils, intoxicants, stimulants like coffee, tea, cool drinks, etc. You must stop. Suppose it is not possible. So, friends, eat along with your food. Whatever you want to take, you can. If you want to have a coffee or you want to have alcohol, you can have along with your food. Now let's see, friends. Again, 10 a.m. to 8 p.m. I am giving you almost a about 10 hours of window, eating window. In 10 hours, what needs the best results? In 10 hours, choose your time, friend, your convenience. Okay, your hunger, primarily based on hunger. Choose eating only 2 times during that period. So you find ways and means. For few days it's impossible because you're already habituated to eat breakfast, lunch, dinner, snacks, coffee, tea, and all that 6 to 7 times. Switching to 2 times is very difficult. Initial 4 5 days it'll be miserable. So that such people, what you can do, continue 3 times eating only. You can have breakfast, lunch, dinner, but nothing in between these 3 meals except water. Now, over a period of time, maybe few days, you come to 2 times eating, friend. I tell people, even your favorite God appears and offers you prasadam. Thank him, keep it along with you, and eat along with your meal. If you follow this simple principle, you can improve your health substantially. As I said to you, friends, other than water is food. Anything goes into the stomach other than water requires digestion. Once it is digested, the blood absorbs sugars. To control the sugars, there is insulin. Now, what is happening? Over the years, we are eating 6 to 7 times. So, what happens? There is always sugar and the insulin. But the body is so designed, the sugar levels will be kept in normal, below 99 milligram per deciliter. But the insulin levels are going up over the years. So, what happens? Elevated insulin levels, longer duration of the day is going to cause insulin resistance. Then what happens? Insulin resistance is the root cause for belly fat, overweight, blood pressure, then PCOD problem, heart problem, thyroid problem, and pre-diabetes and diabetes. Friends, sugar levels will never increase for long period. So a lot of people simply check blood sugar and they say, oh, it's under 99. I'm not having sugar, they say. Friends, sugar fasting sugar is a controlled parameter. By checking that, you will never achieve anything. Say, for example, you are staying in Delhi. In hot summer, somebody calls you up. You say, what is the temperature? I ask you. You are in the bedroom or in the office. You see the temperature of the AC. Oh, it's 16 degree centigrade. But outside temperature may be 40. So similarly, friends, the 16-degree temperature is a control parameter in the AC room. Similarly, fasting sugar below 99 will be maintained for decades, for decades. So don't get be fooled by simply checking fasting sugar. As I said to you, those 7 blood tests will give you a fair idea about your health, friends. Now then what drinking water very important. Don't drink water 20 minutes before eating food, while eating, and until 2 hours after eating food. While you are eating food, if you got stuck up, you can have 1 or 2 gulps of water. And friends, between two meals, you must drink 1 to 2 liters water in installments. How to do that? Suppose you had your first meal at 12 noon. From 2 o'clock, you decide to have your second meal at 8 p.m. So until 7:30, you consciously drink 1 to 2 liters water, friends. And non-exercise activity thermogenesis during the day. Be active, friends. Doing 1 hour physical exercise, walking is very good. On top of it, balance time, keep moving, use the steps, stand, sit up, and all that. Don't sit in the chair continuously. Friends, again, 12 to 14 hours overnight fasting is doable. Once you start at least 12 hours fasting, you will improve substantially. But that does not mean balance 12 hours, you are eating 6 to 7 times. If you can switch to 2 times between that, you will substantially benefit. Fasting once in 15 days is very, very beneficial. And then lankanam when sick. When you are sick, you must fast. We have seen this gentleman with 18% health score and 42 kg overweight. Look at this gentleman has followed this three-step approach. He has done his health checkup. He found out his health score. He realized what are the root causes of the lifestyle disorders. He followed the Dinacharya 9 out of 9 for a span of 4 5 months. Look at the improvements what he had shown. He has lost 20 kg weight. He has lost 9 inches of waist size from pre-diabetes to not 5.9% to 5.4%. Lipids have improved. D and B12 have improved. That's how anybody can improve, friends. Friends, knowledge and discipline are the gateways to your health. You must invest time. These are the fantastic people who are giving lectures free of cost. You must listen to them. These are the few people who have benefited by following the lifestyle modifications. And friends, I said my name is Gangesh Rao. I've improved my health. Last 9 years, I'm helping people free of cost. I want everybody to learn this knowledge. And once you transform your health, you can transform the health of your own family members, then your relatives, your friends, and your neighbors. So, friends, if anybody is interested, they can join my WhatsApp group. My mobile number is 9840852996. Lots of videos I have in my YouTube channel. I encourage you to listen to those videos, enhance your knowledge. If you have got any queries, you are welcome to speak to me. Thank you very much.